Good afternoon. My name is Marcella Leonard. I'm a student at the King College in the BSN program at the Kingsport campus. My presentation is about Huntington's disease and the cost. I have a personal interest in this topic, the cost of saving a life. My thesis is the fact that Huntington's disease is a terminal neurological disorder that I feel there should be more research to find effective treatments and cure. Some background information on Huntington's disease. Huntington's was first discovered by George Huntington in 1872. Even though this disease was discovered over 138 years ago, it has only been recently that scientists and researchers have had the technology to truly study the disease. Symptoms usually appear between the ages of 35 to 44. Once the diagnosis of Huntington's has been made, the patient's outcome typically is only a 20-year life expectancy. As of today, there is no known cure for Huntington's disease. Huntington's disease is a genetic disease that's passed from parent to child. This disease causes nerve cells in the brain to degenerate. It is because of this destruction of the brain neurons that create the symptoms of Huntington's disease. These symptoms include loss of cognitive abilities, emotional issues, and uncontrolled movements called chorea. The chorea is a trademark symptom of Huntington's. Huntington's disease is also sometimes called a profound neurological disease. Huntington's disease is one of the few disorders that affect every area of the brain. Again, the Huntington gene is passed from parent to child. Every child of a Huntington disease patient has a 50-50 chance of developing the disease. This is where my personal interest comes in, is I have a friend of the family. They have 3 generations of Huntington's. The son recently passed away at age 45. His father, who is also a Huntington's patient, is still alive. And his wife recently found out she was pregnant. So they will not know if the child will be a carrier also. Huntington disease occurs in 7 to 10 people out of every 100,000. 40 to 79% of possible Huntington's patients will get tested. The others, 20%, will not. In the words of Arthur K. Baker, once you know, you can't not know. And that statement comes in because of the fact that there is no cure for Huntington's. According to the Federal Food and Drug Administration, Huntington's disease is what is referred to as an orphan disease, or as Baker describes it, it affects too few people to make it worth the drug company's time to try to develop a drug for it on their own. The worst aspect of this disease is that there is no effective cure or even effective treatment to help relieve the symptoms. However, there has been progress not towards a medicinal cure, but towards stopping the gene itself. This research was discovered in 2010 by researchers at UCLA. In August of 2008, the FDA approved the use of tetrabenazine for treatment of chorea in Huntington's patients. This is the first time a drug has been approved to use in the management for symptoms of Huntington's disease. This slide comes from the National Institute of Health. It's a breakdown of federal funding in 2011 for some disease and conditions. As you can see, obviously cancer is a big one, getting $5.9 billion. Huntington's is on the bottom of the list at just $66 million. Even malaria, that we do have treatment for, gets twice what Huntington's receives. In conclusion, I feel that a disease that can claim the lives of multiple generations in the same family, that it's important enough to find a cure for. Therefore, it's important enough to find funding for. Thank you.